Now let's talk about spectrum of health, positive health, and determinants of health. Introduction. To describe health as the absence of disease is inadequate and unsatisfying. Health should be understood as a phenomenon or an experience in its own right. The state of health implies that all natural processes that support life are functioning at an optimal level in their intended alignment. The body, the mind, and soul work as a system with its part contributing equally to whole person. Every organ in our bodies has a natural or healthy state of functioning, as do our emotional, mental, and spiritual states. When we are out of balance, we feel like something is out of place, whether it comes in the form of emotional or physical pain or discomfort, and we naturally want to return to our natural state of harmony when everything works as intended. Therefore, a holistic approach is considered to be more effective because change occurs on all levels, and as a result, positive changes are more likely to last long term and improve a person's overall quality of life. Types of spectrum. The spectrum of health includes 4 different components like physical, emotional, mental, and spiritual. Physical component. Physical health, which is one of the components of the definition of health, could be defined as the absence of diseases or disability of the body parts. Physical health could be defined as the ability to perform routine tasks without any physical restriction. Health is not limited to the biological integrity and the physiological function of the human body. A person who suffers from various diseases or get prey of various diseases easily will not achieve a good and sound physique. People with good and sound physique possesses certain features which become part of his personality. For instance, such a person will have a good complexion, clean skin, and good appetite. Mental component. Mental health is really to do with thinking and being able to work things out. It includes the ability of an individual to learn, to have awareness or consciousness, and to perceive reality. At a higher level, it also involves having a memory and being able to reason rationally and solve problems, as well as being able to work creativity and have a sense of imagination. Emotional component. A person may encounter various feelings or emotions in household such as happiness, anger, or sadness. People might cry or laugh. The emotional component of health is the ability and skill of expressing emotions in an appropriate way. Spiritual component. Spiritual well-being can be considered to be that part of an individual's personality by which we reaches out and strive to live a meaningful and purposeful life. Thus, before declaring the health status of an individual, it is first necessary to clarify, check the fact that whether the person is healthy from all the mentioned perspectives or not. If any of the qualities mentioned above lack in the human being, then the person should not be regarded as healthy in any form. They are all interrelated with each other and are inseparable. Positive health. A person who enjoys health at the three phases, that is, physically, mentally, and socially well-being, is said to be in a state of positive health. A positive health is an innovative approach to improving health and well-being that focuses on promoting health assets rather than focusing on the prevention, the diagnosis, and treatment of disease. Positive health can be operationalized by a combination of excellent status on biological, subjective, and functional measures. The field of positive health has direct parallel to the field of positive psychology, parallels that suggest that a focus on health rather than illness will be the cost-saving and life-saving. Determinants of health. Determinants of health are the range of personal, social, economic, and environmental factors which determines the health status of individual and populations. The causes of poor health are complex. A society's understanding of the determinants of health has an important influence on the strategies it uses to maintain and improve the health of its population. Many factors combine together to affect health of an individuals and communities. Whether people are healthy or not, it is determined by their circumstances and environment. To a large extent, factors such as where we live, the state of our environment, genetics, our income and education level, and our relationship with friends and family all have considerable impacts on health. In order to improve population health status and reduce health inequalities, it is important to identify and understand the main factors that protect and promote good health. These factors are known as the determinants of health. Age, sex, and genetic factors are central but not modifiable. At the other extreme, there are global factors that affect our health. Demographic changes also affect population health. Individual lifestyle factors such as diet, smoking, and alcohol, physical activities, and sexual behavior are also important. Thus, the familiar model developed by Dahlgren and Whitehead in the year 1991 neatly summarizes the determinants of health. They talk of the layers of influence on health. They describe a social ecological theory to health. They attempt to map the relationship between the individual, their environment, and disease. Individuals are at the center with a set of fixed genes. Surrounding them are influence on health that can be modified. The first layer is personal behaviors and way of living that can be promote or damage health. The next layer is social and community influences which provide mutual support for members of the community in unfavorable conditions. But they can also provide no support or have a negative effect. The third layer includes structural factors like housing, working conditions, access to the services, and provision of essential facilities. Keeping in view the above models, the following health determinants are described as follows. Early childhood development. Prenatal and early childhood experiences have a positive impact on brain development, school readiness, and health in later life. At the same time, all of the other determinants of health affects the physical, social, mental, emotional, and spiritual development of children and youth. Early childhood experiences have strong, immediate, and longer-lasting biological, psychological, social effects upon health. Health effects may also result from early psychological experiences that create a sense of control or self-efficacy. Pathway effects refer to a situation when children's exposures to risk factors at one point do not have immediate health effects but later lead to situations that do have health consequences. For instance, it is not an immediate health issue if young children lack readiness to learn as they enter school, but limited learning abilities can lead to experiences that are harmful to one's health in later life, such as lower educational attainment. Now we have physical environment. Factors in our natural environment, for example, air, water quality, and human-built environment, for example, housing, workplace, safety, and road design play a role in individual and public health. Safe water and clean air, healthy workplaces, safe houses, communities, and road all contribute to good health. Now we have income. Income is the single most important determinant of health. Health status improves with prosperity and social standing. High income determines living conditions such as safe housing and ability to buy sufficient good food. There is a persistent correlation worldwide between low income and poor health. Adequate income is an prerequisite for many other determinants of health. For example, adequate housing, a nutritious diet, and educational opportunity. And after this, lower income is connected to sickness and shortening of human life cycle. Income is perhaps the most important social determinant of health. Now we have education. Education is an important social determinant of health. Education contributes to health and prosperity by equipping people with knowledge and skill for problem solving, and helps provide a sense of control and mastery over life's circumstances. It increases opportunity for job and income security and job satisfaction, and it improves people's ability to access and understand information to help keep them healthy. People with higher education tend to be healthier than those with lower educational attainment. Low education level are linked with poor health, more stress, and lower self-confidence. Level of education is highly correlated with other social determinants of health, such as the level of income, employment security, and working conditions. Viewed in this light, education helps people to move up the socio-economic ladder and provides better access to other societal and economic resources. Now we have unemployment and working conditions. Unemployment, underemployment, stressful or unsafe work are associated with poorer health. Employment provides income, a sense of identity, and helps to structure day-to-day life. Lack of employment is associated with physical and mental health problems that includes depression, anxiety, and increased suicide rates. Excessive hours of work increase chances of physiological and psychological problems such as sleep deprivation, high blood pressure, and heart disease. Consequently, job insecurity has negative effects on personal relationship, parenting effectiveness, and children's behavior. After this, we have food insecurity. Food is one of the basic human needs, and it is an important determinant of health and human dignity. People who experience food insecurity are unable to have an adequate diet in terms of its quality or quantity. Food insecurity is a barrier to adequate nutritional intake. Dietary deficiencies more common among food insecure households are associated with increased likelihood of chronic diseases and difficulties in managing diseases. Malnutrition during childhood has long-term effects on a child's physiological and psychological development. Now we have housing. Housing is an absolute necessity for living a healthy life, and living in unsafe, unaffordable, or insecure housing increases the risks of many health problems. Lack of economic resources is the prime reason because of which many experience housing problems. The presence of lead and mold, poor heating and draft, inadequate ventilation, vermin, and overcrowding are all determinants of adverse health outcomes. Children who live in low-quality housing conditions have a greater likelihood of poor health outcome in both childhood and as adults. Social status and social exclusion. Exclusion from social production is a lack of opportunity to participate and contribute to social and cultural activities. Much of this results from the lack of financial resources that facilitate involvement. Social exclusion creates a sense of powerlessness, hopelessness, and depression that further diminish the possibilities of inclusion in society. Then come health services. High quality, accessible health services and health promotion contribute to public health. Health services include access and use of services that prevent and treat disease that influences health. High quality healthcare services are a social determinant of health as well as a basic human right. The main purposes of a universal healthcare system is to protect the health of citizens and spread health costs across the whole society. A universal healthcare system is especially effective in protecting citizens with lower incomes who cannot afford private healthcare insurance. Now, culture. culture in its broadest sense refers to accepted patterns and norms of behavior within identifiable groups in society. The most obvious cultural groups are those based on ethnic identity, but other societal groups based on, for example, social class, religion, age, occupation, location, and leisure time activity also have their own distinct culture. Cultural factors can have both a positive and a negative influence on health. Culture is integrated in a string of the aforementioned determinants. There is a growing recognition that the most powerful determinants of health in contemporary population are to be found in social, economic, and cultural circumstances. Various cultural values are a contributing factor to many occurrences which lead to poor health. Then gender. Man and woman suffer from different types of diseases at different ages. Gender points out to the necessity to recognize gender equality, the socially determined role of women, distribution of power and good in a society, as well as those special risks for certain illnesses connected with different male and female role in a society. Inequality in relation to gender is an important determinant of health. Now we have another determinant, social support networks. Support from families, friends, and communities is associated with better health. People with strong family, cultural, and community ties have better health than people who are socially isolated. Single-parent families, people with mental illness, people with disabilities, people living alone, and older people are particularly vulnerable to social isolation. Culture, costume, and traditions, and the beliefs of the family and community all affect health. Now another determinant is genetics. Risk for almost any disease in human population is the result of interaction between inherited genes, variation, and environmental factors, which includes chemical, physical, infectious, behavioral, nutritive, social, and other factors. Inheritance plays a part in determining lifespans, healthiness, and the livelihood of developing certain illness. Genetic variations were discovered not only in relation to rare diseases but also to those that increases susceptibility to a common chronic diseases such as cancer, heart disease, and so on. With the discussion of the above matter, we can conclude the present topic as a person is said to be healthy as a whole when the body, mind, and soul work together as a system with its part. A person who enjoys health at the different three phases, that is, physically, mentally, and socially well-being, is said to be in a state of positive health. Determinants of health, which includes personal, social, economic, and environmental factors, determine the health status of individual and population. Whether a person is healthy or not, it is determined by their circumstances and environment. Individual lifestyle factors such as diet, smoking and alcohol, physical activity, and sexual behavior are also responsible for a person's health. A clean and safe environment, adequate income, meaningful role in society, good housing, population-based services and utilities, affordable nutritious food, education and social support within communities all contributes towards good health. Therefore, a holistic approach comprising physical, emotional, mental, social and spiritual state is considered to be more effective and improves a person's overall quality of life.